As nurses in primary health care, screening is part of our daily practice. We screen blood pressure, weight, TB symptoms, we monitor viral load and CD4 counts. What is newer in many settings is screening for mental health. Mental health is not separate from physical health. It directly influences how patients manage their conditions, take their medication, and engage in their care. One of the most common mental health conditions we encounter is depression. Depression is not just a feeling of sadness. It affects energy, concentration, sleep, appetite, motivation, and hope. And all of these factors directly influence health behavior. In HIV care, this is especially important. Research shows that depression affects approximately 1 in 2 people living with HIV. That means that if you see 10 patients on ART in a day, as many as 5 of them may be experiencing symptoms of depression, even if they do not say it directly. Some may appear tired, withdrawn, inconsistent with treatment, and when in fact they are struggling with low mood, hopelessness, or lack of motivation. When we begin screening for mental health, one of the most important foundations is confidentiality. Many patients hesitate to disclose emotional or psychological difficulties. This is often not because they are not struggling, but because they are unsure whether it is safe to share. Mental health stigma remains strong. Patients may fear being judged, labeled, or treated differently. Some worry that others in the clinic will find out. Others fear that their community or family may hear about it. If patients do not feel safe, they will say no to every question. Confidentiality is what creates safety. Confidentiality means that the information a patient shares remains within the clinical team involved in their care. This includes the nurse, the doctor, the pharmacist, or even the counselor. It does not mean the information is shared openly in the clinic. It does not mean we discuss patients in corridors or waiting areas. It means information is shared only for the purpose of providing care. It is important to explain confidentiality before beginning mental health screening, not after a patient has disclosed something sensitive. For example, you might say, "Before we continue, I want to remind you that everything we discussed today is private and stays between you and the clinical team. The only time we would need to involve someone else is if we are concerned about your safety." As nurses conducting screening, it is important to remember we are screening, not diagnosing. A positive screen is an indicator that further assessment is required. It is not a final diagnosis. When referring a patient after a positive screen, you first thank the patient for sharing, acknowledge that it may have been difficult to answer those questions, then explain the next step clearly and calmly. It is crucial that referrals are handled privately and respectfully. Confidentiality builds trust. Trust builds disclosure. Disclosure allows intervention. Referral pathways differ across clinics, and nurses are not expected to manage mental health concerns alone. After completing physical screening, you might say, "We've gone through your physical health and your treatment. Before we finish, I'd like to ask you a few brief routine questions about how you've been feeling over the past couple of weeks." We ask these questions to all our patients because emotional health can affect physical health and treatment. This is where you remind your patients about confidentiality. The first tool is brief and simple. It asks yes or no questions about common symptoms. This first screener helps us quickly identify whether further assessment is needed. If a patient answers no to all the questions in the first screener, you may proceed with the consultation as usual. However, if a patient answers yes to any of the questions, they must complete a second screening tool. Even one yes means we move to the next step. This does not mean that the patient is depressed. It means we need more information. The second tool asks about frequency of symptoms. You might say, thank you for answering those questions. I'd now like to ask you a few follow-up questions about how often you've experienced certain symptoms. The patient then chooses how many days they have experienced the symptom. Each response corresponds to a numerical score. It is important to clarify that we are asking about the timeline of their symptoms. If the patient is unsure, guide them gently. Like, think about the last 14 days. On how many days did you feel this way? After completing all items on the second screening tool, you must total the scores. Each response category has a number assigned to it. For an example, if they say never, it's a 0. 1 to 7 days is a 1. 8 to 11 days is a 2. 12 to 14 days is a 3. You will add the numbers under each question to calculate the total score. Once complete, you transition based on the score. Based on your responses, I'd like my colleague to speak with you further so we can support you properly. Referral must be made to the medical officer with any sign of suicidal ideation. Even if they scored no on the first screener, when it comes to the second screener and they score anything above 1 on suicidality, they need to be referred. It is essential to clearly indicate whether a mental health screening has been conducted and whether the patient screened positive. Ensuring that these boxes are accurately ticked allows the data capturer to correctly scan the barcode and capture the information in the system. This step is critical as the City of Cape Town is actively collecting data on how many patients are getting screened for their mental health. Alright, this is Pumla. Now that I have asked you about all the physical symptoms, now I am going to be asking you about your mental health. So these are mental health questions that I'm going to be asking you about. And remember, everything that we speak about here stays in the space between you and me and the clinical team. Okay? All these questions you need to answer yes or no. Okay? The first question would be, have you been feeling nervous, anxious, or on the edge?
Yes, sister, I've been feeling like that lately.
Okay, that, all right. Now tell me, have you had any thoughts of or plans of suicide or harming yourself?
No, sister, I don't have.
You haven't had those. Okay. Thank you so much, Sis Pumla. Remember, I said these were just yes or no questions. Now I'm going to proceed and ask, because you have endorsed some of those symptoms. Now I want to know how long you've been feeling like that. Okay. All right. Now I want to find out how often you have experienced those symptoms, like the little interest or pleasure in doing things in the past 14 days. That is the 2 weeks, past 2 weeks. How often have you felt like that?
Yo, it happens almost every day, sister. Almost every day. I'm sure it will change just one day, and then the other day I don't have any interest in doing anything. Okay. And even at home, it will be, at times it will be 3 days. I don't want to do anything. I don't want to go out. I want to be in the house.
Okay. Remember, 2 weeks, today is Tuesday. Né? So if we go back, last week Tuesday, it will be 1 week. That week Tuesday, it constitutes 2 weeks.
I'm sure in a week, I'm talking about from now, the 2 weeks, I'm sure it happens maybe 4 to 5 times in a week.
in a week. Okay, all right, I get you, Stanofan. So thank you so much, Sisi, for answering these questions honestly, and for giving me time to ask you about these questions, because I know sometimes it's not easy to talk about these things. Now I'm going to be referring you. Remember, I said the clinic staff name. I'm going to be referring you to someone who is going to look deeper into this and see what the problem is. Is that fine with you?